Welcome back. The subject is Alzheimer's, and our guest is Mark Freed. Mark, welcome.
Thank you. Thank you for being here.
CEO, president of Alzheimer's all over the state of Oklahoma.
That's correct. We serve all 77 counties.
Okay, before we get into this, is it on the increase?
It is on the increase. Alzheimer's disease is a progressive brain disease that leads to death, and the number one risk for developing the disease is age. And so when you look at the fact that there's a baby boomer population where 10,000 baby boomers are turning 65 every single day, the risk is beginning to truly soar. Right now, there's about 5.5 million Americans who have Alzheimer's disease. If you fast forward to the middle of the next decade, there'll be a little more than somewhere around 7.5 million. So it's about a 30% increase from where we are now to where we will be in just about 10 years.
This is very scary. Every 66 seconds, somebody diagnosed?
That's 66 seconds. Then that didn't take very long. I mean, that's the that's a couple of commercials that you see on TV. That's most of them are 30 seconds. You wrap two of those together, and another one has developed the disease.
I want to
in our country.
ask you a question, and I know
Sure.
this is going to sound so simplistic, but a lot of folk have asked this before. Have they nailed down a cause?
They have not nailed down the cause. There are two different kind of ideas on what is the key reason for developing the disease. The cause is not known. Now, the biology of it, there's a better handle on what that means. But when it starts, how it starts, why it starts, we don't know that.
Alzheimer's, dementia,
Sure.
are they related?
They are. Well, so if you think in terms of cancer, if cancer is the umbrella term, if someone has leukemia, they have cancer. If they have cancer, they don't necessarily have leukemia. Well, dementia is the umbrella term, right? So if someone has Alzheimer's, they have dementia. If they have dementia, they don't necessarily have Alzheimer's disease. There's 7 different forms of dementia. The most prevalent is Alzheimer's disease. So about 70% of those who have dementia have Alzheimer's disease. The thing about the difference between all of those different kinds of dementia is how the brain is impacted. Each form of dementia leads to death. But the way the brain is impacted is the difference between one to the next. The way the symptoms manifest themselves, whether it's vascular dementia or frontotemporal, that sort of thing, the way the symptoms manifest themselves are very similar. And so the Alzheimer's Association, we are here to provide support for anyone who's affected by any sort of dementia.
Now, you don't mean just victims. You mean family, you mean caregivers, you mean
Absolutely.
the whole spectrum.
Absolutely, and primarily who we end up working hand to hand with is the family caregivers who are facing this every day.
One of the things that I'm struck by when it comes to Alzheimer's is the fact that this disease can become a nuclear issue in any strong family.
Sure.
It can literally blow it apart. And I've seen that happen. I have seen families just rip right down the center in attempting to deal with a father or a mother who has it.
Right.
Is there an age where it normally sets in?
Well, I don't think we would look at it and say there's a specific age, but we know that if someone hits 65, they're now about a 1 in 9 risk of developing Alzheimer's disease.
Whoa.
If they hit 85, they're 1 in 3. And with that being said,
Did you say 1 in 3?
1 in 3 of individuals who are 85 or older here in our country have Alzheimer's disease today. With that said, there is about 200,000 people here in America that are under the age of 65 who have Alzheimer's. Here in our chapter, we've encountered folks in the 30s and 40s who have developed the disease.
Is that right?
That's correct.
Well, I know for a fact, because I've read a lot of your material, and I've kind of read up on this. My mother had it, died from it, that things such as exercise won't prevent it, but helps hold it at bay. Not smoking, certain kinds of food, if more vegetables, more fruits, will help you lead a healthier life.
Right.
There's got to be some connection. There's got to be, and I'm not putting your feet to the fire here,
Sure.
but there's got to be something we're not doing right.
Well, for so long, the understanding of the disease was that it's just a memory loss issue. And science has proven that this is not a memory a memory loss issue. It is an overall health issue. And so there's more evidence that is showing us that if someone engages in a healthy lifestyle, then it will give them a better chance of delaying the onset of the disease. Does that mean it will? Not necessarily. I mean, you think about folks who are marathon runners who may also deal with heart disease. You may have someone who's an avid cyclist and they're vegetarian and yet they develop diabetes. So there's no guarantee that any kind of lifestyle will determine that we are not susceptible to some
Sure.
sort of disease that way. But what we do know is that if we engage in a healthy lifestyle, our basic rule is what's good for the heart is good for the brain. And so if folks will engage in that way, it'll give them a better chance of delaying the onset.
Are there tests to determine whether or not you're predisposed?
Predisposed, yes, there are tests for that. If there are, the reality of the disease is that there is a family connection, like with a lot of other diseases, and we haven't always understood that, and most people don't, recognize it in that way. You think about families that have just been ripped apart by breast cancer, and you can see generations that have been affected by that. Same goes for Alzheimer's disease, and so if there is, for my college roommate does not have Alzheimer's in his family history. It means I'm about 50% more likely to develop Alzheimer's than he is because it does run in my family. Mm-hmm. It doesn't mean that I will develop the disease. It doesn't mean that he won't. It just means the risks are elevated. With that said, there is a genetic component that affects a very small number of individuals who have Alzheimer's. So if you think that there's 5.5 million Americans who have the disease, only about 3% of those have the genetic disposition that guarantees that they'll have the disease. So for us, there may be a predisposition. We advise to talk to a healthcare provider before anyone starts to look into the idea of possibly doing some sort of genetic testing to see if they have a gene that would make them more likely to develop it.
Let's talk a little bit about the organization itself.
Sure.
5 different spots in Oklahoma. Yep. Where are you?
We're in Tulsa and Oklahoma City, and then we have satellite offices in Enid, Lawton, and Ada.
And I guess those folks are busy.
We're all busy. We're trying to raise money to advance research and to get us to a day where there is no disease. We're trying to raise the awareness so that more and more people understand really what they're looking at and understand that it is a public health issue. And at the same time, we're trying to walk hand in hand with as many folks as we possibly can, and knowing that there are 63,000 Oklahomans today that have Alzheimer's dementia, and then there's also about 223,000 unpaid family caregivers right here in this state. And so we're here to provide services and support for everybody who's affected.
That's what I was about to bring up. You guys offer a number of services, not the least of which is if someone gets up, decides, today I've got it. Mm-hmm. What do I need to do? I can call you and say, hey, I'm doing this. I walk into a room and I've forgotten what I'm there for. That doesn't necessarily mean Alzheimer's.
Right, and so one of the biggest pieces of our mission is to educate people about what that is. Mm-hmm. What's the difference between a normal part of aging and something that would actually mean that there is a concern whether or not someone has developed Alzheimer's dementia. And so with that said, community education is a very high priority for us, as well as things that are a little more hands-on, where we're actually working specifically with families and in a care consultation role to talk them through their situation and see and help them develop a plan of care.
Other end of the spectrum is counseling. You work with caregivers right and left, don't you?
Sometimes we're working just with the spouse. Sometimes we're working with the spouse and maybe a couple of the adult children to help them put together a plan of care. And going back to what you said earlier, that's a role where it's important, for us to be there just to help everyone continually stay focused on what's the important thing. What are we trying to accomplish? Because when you talk about, quality of care, how long, is there a time where we need to start considering if someone needs to be placed into a senior housing community, or when do we take the keys away? All those different things, so that we can be there and help everyone stay focused on the conversation.
You guys are launching a fundraiser pretty soon, aren't you? Tell us
We
about
do, yeah. The Walk to End Alzheimer's is a signature fundraiser for the Alzheimer's Association. And actually, the walk here in Tulsa last year was the 15th largest walk in the country in dollars raised. There's 650 walks in the country, and Tulsa raised over $820,000. Oklahoma City was number 20 in the country. So 2 of the top 20 were right here from the state of Oklahoma. And the event's coming up on September the 23rd. It'll be at Tulsa University, and we're excited to have it there. The chair for this year is Ashley Montgomery. She's the wife of Coach Philip Montgomery, the head coach for the TU football team, and she's making it happen. We're getting the wheels turning
fire.
Absolutely, and she's already set the goal. We want to raise $1 million to fight this disease with the walk. Absolutely,
it is doable.
Without question, it is doable.
Just don't turn to the state.
That's right.
Hey, thank you.
Thank you very much for the
And
chance.
keep us posted and let us know down the road if we can help.
You bet. We absolutely will do. We know that with 28 people here on our staff, we can't possibly serve everyone. We need a Purple Army of folks who want
Well, you
to
do.
attack
And
this
volunteers
disease.
are needed, and if you want to be a part, call them. They'll tell you how to roll up your sleeves and get involved. Still to come, we've got developments coming up with the Food Bank of Eastern Oklahoma right after this.